This is Tish. Tish is a healthcare navigator.
Turn right, then you have reached your destination.
Just like the GPS guides her through the city, she guides patients through the healthcare system, where it's just as easy to get lost. In the Latino community, we call navigators promotoras. This is Julio. He works one-on-one with people in the community to help them stay well. Tish and Julio respond when and where the need is greatest. They help people in their community get past barriers, things that stop them from doing what they need to do to be healthy. They get to know patients while they're doing rehab. Sometimes Tish and Julio start working with patients while they're sick in the hospital. They'll also meet with them during checkups at their doctor's office. Wherever the need is, Tish and Julio respond. The navigator gets to know the patient, and the patient gets to know the navigator. They are part of the same community. What health navigators do overlaps with what other members of the healthcare team do. People such as doctors, nurses, health educators, and social workers. The navigators take their knowledge about health and the healthcare system and their understanding of the communities where they live and build bridges between them.
We work as a team to try to figure out and solve barriers that patients are experiencing.
Come in.
Hey. My visit yesterday with Mr. Gomez, I actually ran into a couple of issues with him. I wanted to come to you guys to actually see what you guys think about this. The first one was actually high blood pressure.
And does he own a blood pressure monitor? Does he have one at home?
I'm sure he doesn't, and I don't think he can afford it.
Well, let's see if we can get him one, actually.
Then we help patients carry out the solutions.
Hey, Julio! Look what I got for you, man.
Then we document everything that happens.
Absolutely everything. Where do navigators work? On the phone, over the internet, in patients' homes, at the pharmacy, in hospitals, in clinics and doctors' offices, just about anywhere the patient needs help. What types of health problems do health navigators help people with? Stroke, cancer, problem pregnancies, having lost an arm or a leg, accidents like ones that cause brain injury or spinal cord injury. Just about any health problem a person needs help with. It's important for navigators to establish a rapport with their patients. The trust and respect they develop for each other is important. When the patient is comfortable with the navigator, then the navigator can help the patient get past all kinds of barriers standing in the way of getting healthy. One of the great things about being a health navigator is the sense of satisfaction that comes from helping people.
I felt good helping her because she felt like she can call me and ask me any question. I told her at any given time she need me, just call me. Oh, you forgot, you don't know if you took your meds? Okay, no problem. What I need you to do, no problem, no problem. You have a good day. Bye-bye.
Sometimes, however, the line between establishing trust and creating overdependence can be a fine one.
The next call that I got, she called me and asked me about problems with Metro Access. Once she called, she asked me, was it too late for her to call Metro Access to get an appointment for her to go and get her hair done. I felt like, you know, that can also be an emergency, but that's only like during work hours. When you call me late night like that and I'm getting ready to go to bed or something and you're calling about Metro Access, they're closed. So the best advice that I could give her was, to wake up in the morning and give them a call in the morning and, see if they could take you at that time. Hey, Betty Ann, how you doing today? All right, what's going on? Do I watch Channel 9 stories? Well, normally I don't really have time to watch those things for the simple fact that...
Betty Ann clearly has rapport with her navigator. Tish tries to bring the focus back to Betty Ann's health.
And everything, and following the diet. Remember the diet that we talked about. Well, one navigator and client is always supposed to be keeping on a professional level. You never want to cross that boundary. Hey, Betty Ann, what's going on? Oh, your cable out?
Cable problems are not a barrier health navigators are expected to resolve. Tish is feeling like the situation is getting out of hand.
The next time she called me, she was in an uproar. They didn't never show up. And I asked her again, did she call so they, make her an appointment for them to come out? She said, no, Tish, they didn't call. They didn't come back out. They didn't call or anything. I don't know what to do. And I, advised her, okay, well, next door you have a neighbor and you guys, speak or talk every now and then. So why don't you go over next door to the neighbor's house and see if you can watch a little bit of cable with her, get acquainted with her, get to know her a little bit better. Because that's what we try to do to get you back into the community. And she said she was going to try that, and that was it. I'm really so used to the patient calling me all the time that for some forsaken reason I got into bed this night and my phone never rung. So it didn't bother me at first that she didn't call that night. Then all of a sudden, she wasn't calling at all. I started second guessing myself because she had completely stopped calling all the way around and I got worried.
Tish called it right. Betty Ann is in the pink. Literally. She is taking her meds and on her way to getting integrated back into the community. Identifying barriers, why patients aren't following their care plans, and helping them break through those barriers is one of the most important parts of being a navigator. Julio notices that Mr. Gomez's blood pressure is up and asks him if he is taking his medication.
No.
No? Just plain no? Julio tries to find out more.
I see. Why exactly have you stopped taking the medications?
Oh, porque se me ha terminado. Esa es la razón por qué no estoy tomando la medicina. No tengo.
Not taking it because it ran out? There's something more here, Julio thinks. Sometimes, being a navigator is kind of like being a detective.
Has the doctor stopped your medications?
No, la razón es que no tengo la receta médica.
No prescription? But the doctor didn't stop the medication? Julio keeps trying to find out what the barrier is, but he is careful not to be prying or offensive.
Why didn't the doctor give you prescription?
Oh, perdí la visita la semana pasada.
What happened exactly?
No, pero no tengo transportación.
Julio knows Mr. Gomez likes to use a specific cab company to get around. He wonders if there's a problem with the service.
The cab didn't come for you?
No, el taxi muy caro y la parada del bus está muy lejos.
Has something unusual happened, Mr. Gomez?
Sí, tengo el cobro del hospital y está bien alto.
Ah, now it's starting to make sense. Mr. Gomez is starting to feel the burden of the bills from the time he was in the hospital after his stroke.
Did you call the doctor?
No, está muy ocupado y él va a estar muy enojado porque no ha hecho la poema.
I understand.
Sí, ha habido muchos problemas con los últimos días por el ataque que he tenido, ¿no?
Julio is a good listener, and Mr. Gomez begins to confide in him. Still, Mr. Gomez's problems are not simple, and Julio needs help. If you don't know, find out.
Come in.
So with my visit yesterday with Mr. Gomez, I actually ran into a couple of issues with him. I wanted to come to you guys to actually see what you guys think about this. The first one was actually high blood pressure. When I did check his blood pressure was, pretty high. And I think that,
As part of the healthcare team, Navigators always have a backup.
We went into depth about that, and he actually hasn't seen his doctor either, and due to him actually having transportation issues, and that stems off from actually having financial problems because of his high hospital bills. So again, I bring these to the table, and I just wanted to see what exactly you guys thought.
Okay, so Julio, this is a big deal. Blood pressure being too high is particularly a problem for people who've recently had a stroke. It can cause more damage to the blood vessels in the brain, but also in the heart, the kidneys, the eyes, and so forth. Does he own a blood pressure monitor? Does he have one at home?
I'm sure he doesn't, and I don't think he can afford it.
Well, let's see if we can get him one, actually. People who take their own blood pressure tend to be a lot more invested in taking their pills, too.
A determined approach is what we call working with the healthcare team to find ways to help patients remove barriers standing in the way of their health.
Hey, Julio! Look what I got for you, man.
Julio takes the blood pressure monitor right over to Mr. Gomez. He makes sure Mr. Gomez knows how to use it properly and understands why watching his blood pressure is such a big deal after a stroke. Afterwards, as always, Julio documents everything that happened with Mr. Gomez. Documentation is very important in health navigation. Everything that has happened in working with patients can have an impact on how navigators help them with barriers in the future. What are some of the qualities of a health navigator? Being open to learning is one of the most important qualities. Tish wants to know everything she can about the medical conditions her patients have.
My new patient, the one I just saw yesterday, had a HEMORRHAGIC stroke.
Hemorrhagic stroke.
Right. And then she's in a coma. I'm not really understanding that.
Okay, this can be a real problem. So why don't we talk a little bit about the different kinds of stroke and explain what's going on here. So if you think about the different kinds of stroke, we usually we break it down into ischemic stroke, okay, and hemorrhagic stroke.
Julio wants to understand better how to handle sensitive issues.
Alright, so speaking with Mr. Gomez, he actually expressed to me that he is having financial issues, but he really didn't go into depth of what exactly they were. So I'm kind of stuck at that part.
There's a number of reasons why he might not be talking about that. Having had a stroke, he may not be all that aware of exactly what they are. He may know that there are financial problems, but he may not know the details himself. It might be that talking to his family is better. We also don't know, just in general in society, we don't talk about money a lot. It may be hard for him.
Tish wants to be sure she is giving her patients accurate information.
Betty Ann is having a lot of issues with her cholesterol. She doesn't know how to control it, and I really don't know how to, explain it to her, how to help her control it.
Okay, well, start by telling her that cholesterol is actually a type of fat, and basically it comes from the fat that you eat in your body. That's one thing. Then there's also the genetic components of cholesterol, so depending on...
Navigators are dependable. Tish keeps her appointments rain or shine. Navigators are conscientious and pay attention to details. Julio is respectful of Mr. Gomez's home and makes sure he shuts the gate after himself. Tish's friend Donna is surprised to see her in Betty Ann's neighborhood and wants to know who she is visiting. Tish respects Betty Ann's privacy and keeps that information to herself. What prepares a person to be a good health navigator? Being a good communicator, knowing how to reach out to people, is essential for navigators. Having graduated from high school or having a GED is a big help to navigators. They need to be able to learn medical terminology and understand a lot about prescriptions and how health insurance works. Computers and the internet are becoming more and more important for teaching patients and keeping records. Navigators need to be comfortable with technology and willing to learn and use it. Helping patients regain their health is the reward of being a health navigator. Of course, like all worthwhile things, health navigation does have its challenges. You will have to deal with a fragmented healthcare system. Doctors don't always prescribe drugs that insurance will pay for. It can be a job tracking down doctors to get those prescriptions changed.
I wanted to ask a question because I'm trying to reach Dr. Jeffries. I've left numerous voicemails. Yes, ma'am. The problem is the Dr. Jeffries ordered Lipitor for the patient, and we can't get the Lipitor. The insurance company will not pay for it. Right. They will not pay for it. So, this is Tisha. Yes.
And sometimes a little smart thinking is called for.
I just wanted to know, do you know what time he has clinic? Because that way I can probably try to catch him while I'm upstairs.
You go, girl.
Okay. 8 o'clock? Okay, that's fine. I'll try to catch him then.
A navigator is always busy. You meet with current patients. You follow up on their problems. You attend meetings with the team. And then you get new patients. And you have to document everything you do. That's why time management is so important. Working with patients is the reward, but also the challenge of being a health navigator. You will learn to help with overdependence, confusion and anxiety, complicated medical problems that are made even more difficult by personal situations, shyness, and embarrassment. It can be a challenge to find your way through diverse communities in a big city, part of a world of need.